Okay, so now we're moving on to section 2 of chapter 18. We're going to talk about the heart valves. And heart valves are really important because they ensure that our blood flow in our body is unidirectional, so moving in one direction. We don't want our blood to move backwards ever, or bad things would happen. So these valves help ensure that we're moving it in one direction. They open and close in response to different changes in pressure, which we're going to talk about in a little bit. And we have two major types of valves. So first of all, when we're talking about valves, we're talking about these valves' location, which is going to be either at the entrance of the atrium or between the atria and the ventricles themselves. So we have what are called atrioventricular valves. So these are going to be located between the atria and the ventricle themselves. So there would be one between the right atria and the right ventricle, and then we have one that's located between the left atria and the left ventricle. The other type of valve that we have are what we call semilunar valves, and these are located between the ventricles and then the major arteries that we have. So if we're talking about the right ventricle, it's going to our pulmonary trunk. So it would be located between our right ventricle and pulmonary trunk. And if we're talking about our left ventricle, it would be between our left ventricle and our aorta. So if we're talking about specifically, here's an example. So this is a cross section of the heart where we can kind of see all of the valves here. I don't really like this diagram because it's a little bit confusing. Okay, so let's talk a little bit more about the atrioventricular valves, which are also called AV valves for short. And we have the right AV valve. The right AV valve has a more specific name, and it's called the tricuspid valve. And it's called the tricuspid valve because it actually has 3 cusps. And then we have the left atrioventricular valve, which is also called the mitral valve because it actually resembles a bishop's mitre, which is a hat. But the mitral valve is also called a bicuspid valve because it has 2 cusps. We also have something called chordae tendineae. And the chordae tendineae are just little cords that are made of collagen that are attached to each of these AV valves. And they're kind of really important so that our AV valve doesn't go backwards or flip back into the atria themselves. We want, again, for blood to be unidirectional. So once it's into the ventricle, we don't want it to be able to go back into the atria when our ventricle contract. So these 2 valves, along with the collagen cords called chordae tendineae, help prevent blood from going backwards. Okay, our semilunar valves. So again, these are the ones that are going to help prevent backflow from the major arteries back into the ventricles themselves when the ventricles contract. So we have 2 of the semilunar valves, and these are also going to open and close in response to differences in pressure. When our ventricles contract, it's going to cause the pressure inside the ventricles to rise above the pressure in both of the aorta and the pulmonary trunk. And at this point, these semilunar valves are going to be forced to open, and their cusps are going to flatten against the walls of these arteries, allowing the blood to go through. When the ventricles relax, the blood is going to flow backwards to the heart. As the blood begins to flow backwards to the heart, it's going to cause these cups on these valves to close. So specifically, if we're talking about the pulmonary semilunar valve, this is going to be the one that's located between the right ventricle and the pulmonary trunk. And then we have the aortic or semilunar valve that's located between the left ventricle and the aorta. So these are where the valves are located. I do want to point out that we don't have any valves at the entrances of the vena cava and the pulmonary veins into the atria. So small amounts of blood do actually spurt back into these vessels when our atria contract, but we're mostly concerned with not allowing blood to flow backwards when our ventricles contract. Sometimes we do have leaky valves, and these are going to force the heart to repump the same blood over and over again because the valve doesn't close properly, and some blood does backflow when this occurs. So here's an image that hopefully will make everything that I just said in words a little bit easier to understand. So again, right here, they're showing you blood that's returning to the heart into our right atrium from those 3 different sources. So blood is returning to our right atria from our superior inferior vena cava and our coronary sinus, and our atria are going to begin to fill. As the pressure increases in our right atrium, it is going to cause the valve that's connecting the atria and the ventricle to open. So the AV valve flaps are going to open, and they're going to kind of hang into the ventricle themselves. Then the atria are going to contract to make sure all the blood that was in the atria to begin with ends up into the ventricles themselves. So I was pointing out what was coming, the blood that was coming from the inferior and superior vena cava, but the same thing is happening with our pulmonary veins, all 4 of them, as they're emptying into the left atria. So now we've just emptied all of the blood that was in our right and our left atria into our ventricles, and that's what we're seeing here, our blood in our ventricles. The next thing that's going to happen very, very quickly after it's filled is that our ventricles are going to contract. And when our ventricles contract, that's going to force the blood against the AV valve cuffs, which are these right here, connecting the atria and the ventricles themselves. And when they contract, it's going to push those valves closed. It's also going to cause our semilunar valves to open. So this step was on a second slide. So the ventricles contract. These valves that are connecting the ventricles and the atria are going to close, and at the same time, they're going to cause the semilunar valves to open so that we can send the blood that's in our ventricles out to our major veins and arteries that we need to. So our pulmonary trunk and then our aorta. As the ventricles relax, the intraventricular pressure is going to fall, and the blood is going to start flowing backwards, heading back towards our ventricles. The blood flow back down to our ventricles is what's going to push those semilunar valves closed until we refill it again and our ventricles contract.